The 4 Ds of abnormal psychology explained. In abnormal psychology, the 4 Ds, deviance, distress, dysfunction, and danger, are core criteria used to assess whether a behavior, thought, or emotion might be considered abnormal. These factors help mental health professionals evaluate and diagnose psychological disorders while considering the cultural and individual context. Here's an explanation of each D and how it contributes to understanding abnormal behavior. 1. Deviance. Deviance refers to behaviors, thoughts, or emotions that significantly differ from societal or cultural norms. Note that behaviors that are considered normal in one culture might be seen as abnormal in another. While deviance alone does not indicate a psychological disorder, it raises questions when paired with other signs, such as persistent unusual behavior or beliefs. For example, persistent hallucinations or delusions deviate from typical cognitive functioning and may signal conditions like schizophrenia. 2. Distress. Distress focuses on the emotional pain or discomfort an individual experiences due to their behavior, thoughts, or feelings. For behavior to be considered abnormal, the distress must be excessive and impair the person's quality of life. Importantly, distress may not always be present. Some disorders, like personality disorders, may not cause distress to the individual but affect others around them. For example, chronic anxiety or overwhelming sadness, as seen in anxiety disorders or depression, can cause severe personal distress. 3. Dysfunction. Dysfunction occurs when a person's psychological state interferes with their ability to perform daily activities, such as maintaining relationships, holding a job, or caring for themselves. Dysfunctional behaviors are those that disrupt routines and prevent individuals from achieving their goals or meeting societal expectations. For example, severe procrastination or inability to focus due to ADHD can disrupt work or academic performance, causing functional impairments. 4. Danger. Danger refers to behaviors that pose a risk to the individual or others. This criterion is particularly critical in assessing conditions where self-harm, suicidal tendencies, or aggression toward others is present. While not all psychological disorders involve danger, it is an essential factor in determining the severity and need for intervention. For example, suicidal ideation in depression or violent outbursts in intermittent explosive disorder can pose serious threats to safety. The 4 Ds provide a comprehensive framework for understanding abnormal behavior while emphasizing the importance of context. They highlight that abnormal psychology is not about labeling individuals as different, but rather about identifying patterns that cause significant harm or interfere with well-being. By addressing these dimensions, mental health professionals can better diagnose and treat psychological disorders, promoting improved outcomes and quality of life.